Imagine having a part of your body that's been debated for thousands of years, across cultures, religions, and now modern science. Some people say it's essential for protection and pleasure. Others believe removing it offers cleaner, safer, and healthier living. With so much conflicting information, how do you know what's right for you? Today, we're going to take a deep, unbiased look at one of the most talked about topics in men's health, the foreskin. You'll discover exactly what it does, why some people choose to keep it, why others choose to remove it, and when surgery isn't just a choice, it's a necessity. By the end of this video, you'll have the knowledge to make an informed decision based on evidence, not myths. Let's start with the basics. The foreskin, medically called the prepuce, is a retractable fold of skin that naturally covers the head of the penis, known as the glans. At birth, it's fused to the glans, and over the years, usually by adolescence, it becomes fully retractable. But it's not just extra skin. The foreskin serves several important biological functions. First, protection. It shields the highly sensitive glands from friction against clothing and from potential irritants or bacteria in the environment. Think of it as a built-in protective cover for one of the most delicate parts of the body. Second, moisture and lubrication. The inner layer of the foreskin keeps the glands in a naturally moist environment, which can make intimate activity more comfortable and help maintain a healthy chemical balance. Third, sensation. Packed with thousands of fine-touch nerve endings, the foreskin plays an important role in sexual pleasure and arousal for many men. While the foreskin serves these natural purposes, circumcision, the surgical removal of the foreskin, has its own set of scientifically supported benefits. One major benefit is easier hygiene. With the glands exposed, cleaning becomes simpler, which can help prevent the buildup of smegma, a natural combination of skin cells and oils. While harmless if cleaned regularly, poor hygiene can allow smegma to accumulate, causing odor, inflammation, or infection. Another benefit is a reduced risk of certain infections. Moisture and bacteria can sometimes get trapped under the foreskin, leading to conditions like balanoposthitis, which is inflammation of both the glands and foreskin. Studies show that infant circumcision lowers the risk of urinary tract infections, especially in the first year of life. Circumcision has also been shown to lower the risk of certain sexually transmitted infections. Large-scale studies in Africa, published in respected medical journals like The Lancet, found that male circumcision can reduce the risk of acquiring HIV through heterosexual intercourse by up to 60%. It can also lower the risk of HPV, the human papillomavirus, which is linked to genital warts, cervical cancer in women, and certain cancers in men. There's also a reduced risk of herpes simplex virus type 2, the virus that causes genital herpes. Additionally, circumcision may reduce the risk of penile cancer. While this cancer is rare, its risk factors include chronic inflammation, poor hygiene, and HPV infection, all of which circumcision can help reduce. If you're finding this breakdown helpful, make sure to subscribe so you don't miss future videos where we tackle important health questions with clear, science-based answers. Of course, circumcision is not without its risks and downsides. Like any surgery, it carries potential complications, even if they're generally low when performed by skilled professionals in sterile environments. These risks include pain during and after the procedure, bleeding, infection, and in rare cases cosmetic dissatisfaction, such as uneven skin removal that might require corrective surgery. One of the most debated drawbacks is altered sensation. The foreskin contains many nerve endings, and removing it inevitably changes the sensory experience. Over time, the permanently exposed glands can become slightly thicker and less sensitive through a process called keratinization. Some men notice no change in sexual pleasure, while others report a reduction in sensitivity. This is a deeply personal and subjective matter. Another downside is the permanent loss of the foreskin's natural protective and lubricating functions. Without it, the glans is always exposed to friction from clothing. Now let's talk about when circumcision isn't just an option but a medical necessity. One such situation is phimosis, when the foreskin is too tight to retract. In mild cases, it might be manageable, but in severe cases, it can make cleaning difficult, cause repeated infections, and lead to pain during erections or intercourse. Another urgent condition is paraphimosis. This is when the foreskin is pulled back behind the glands and becomes stuck, restricting blood flow. This is a medical emergency and requires immediate attention to prevent serious damage. Chronic infections are another reason circumcision might be recommended. If conditions like balanoposthitis keep coming back and don't respond to creams or better hygiene, surgery can be the definitive solution. If you're a parent, deciding whether to circumcise a newborn often comes down to cultural, religious, or preventive health beliefs. For adults with no medical issues, the decision is usually based on personal preferences, weighing the possible benefits against the potential risks. It's important to remember that circumcision reduces, but does not eliminate, the risk of sexually transmitted infections. It is not a substitute for safe sex practices. Using condoms and getting regular health checkups remain essential. The foreskin serves real protective and sensory roles, but circumcision also offers measurable health benefits. Neither choice is automatically right for everyone. The best decision is the one that's right for you. If you have any pain, difficulty retracting your foreskin, or frequent infections, speak with a doctor. Avoid basing your decisions solely on what you read in online forums or hear from friends. Your health deserves professional, personalized advice from a qualified medical provider. This has been a balanced, fact-based look at one of the most debated topics in men's health. If you found value in this video, give it a thumbs up, share it, and subscribe to The Healthy Body for more science-backed health content for both men and women. I'm Dr. Alex, and I'll see you in the next video.